all of these skeletal muscles are at rest right now. And we're going to ask some muscles to contract. So most would say, okay, I see what you got. You got the deltoid is contracting to raise that arm. You may not have noticed that there was a space between the teeth in the original image. And so right now, this skeleton is contracting temporalis muscle because these teeth are touching up here. Everything I could ever find on the internet, everywhere, teeth are always touching each other, they're always occluding, there's always occlusion going on. You look up a picture of the temporalis and you see that it must be contracting because these teeth are occluding. I had to digitally alter this just to put a space here to show that what normal rest position would look like. But in dentistry, you kind of go, that's just kind of weird looking. We don't grow up in dental school seeing that. If you look up the medial pterygoid and the lateral pterygoid, you'll get this image. Do you think that the illustrator was tasked to showing contracting medial pterygoid and a contracting superior head of the lateral pterygoid? Because that's what we got. For those teeth to be occluding, that medial pterygoid has to be contracting. During elevation, the superior head of this lateral pterygoid contracts. So that's when I see these now, I'm looking for things. I'm looking for what's going on in this still shot of an activity. And this is an activity right here, but we in dentistry don't see that yet. We still look at, that's a nice class 1 occlusion. That's going to be our biggest TMD Vinci Code term. This comes from a textbook. So if you were to take out the words that don't mean anything right now, this tells us, and we all grew up reading these textbooks and assuming that's got to be true, but you're not kind of sure why it's true. It seems weird. A posterior interference effect is hyperactivity of all of the elevator muscles. A posterior interference, its effect is hyperactivity of the elevator muscles. So there is a posterior interference, a contact. And we're learning that we were told that if that contact, this thing, this item, as if it's an actual object, can cause the elevators to be hyperactive. No way. Never, never, never. It does not happen that way. What really happens? To have so right now, these teeth aren't touching. During sleep, typically, if there are hyperactive elevators, that causes occluding. That's the only way teeth can occlude. You have to have an elevator that contracts and stays contracting. Otherwise, the contact stops. So hyperactive elevators will cause occluding. The occluding scheme will govern the percent recruitment of elevator fibers. So if you have hyperactive elevators, the scheme of occluding teeth, in this example it's going to be these molars, will allow for near maximal contraction. It's not causing maximal contraction, it allows for it. If you were to put an anterior jig that did not allow posterior occluding, you still have constant elevation, but the new occluding scheme now governs the degree of muscle contraction or the number of fibers contracting. So where this was a big, huge force vector arrow, it's much smaller now. Nothing's changed in the position of the mandible or anything like that. It's the occluding scheme that's now governed the amount of muscle contraction intensity. A better term is trigeminal motor innervation to the elevators. I like to keep bringing back to what this trigeminal nerve is doing, because when you think about migraine and you talk in those terms to the neurologist, they think you know what you're talking about. You might not, but it sounds better. So this term, the occlusion, to me that is an activity. It's not a thing. You can't hold an occlusion anywhere. It is the result of contracting, elevating musculature. So I don't say the occlusion anymore. I call it the occluding scheme, and the occluding scheme changes all the time. Occlusions happen on articulators when you look at them. Occluding schemes are things that happen to real people that can change from minute to minute. And the report that they give you and the signs that you see tell you how this occluding scheme might be affecting that patient.